the food hygiene is not good, what is the problem with that? What will happen to health? Okay, I'll give you a clue. So, one of the commonest things is foodborne illnesses. Okay, so you have the major cause of foodborne illness shown here: improper cooking, poor personal hygiene, cross-contamination, improper food handling, unclean equipment, unsafe holding, use of unsafe cleaning, infected food handlers, insects and rodents, chemicals in food. So these are the common causes of food poisoning. So which is why food hygiene is very important. Okay. So you understand the importance of this. That is why food hygiene is a major thing. Nowadays, most people are eating from outside. We are having Zomato, Swiggy, etc., etc. We are taking food, but we don't know how it is maintained. What are the things that is done? So let us talk about food hygiene. So food hygiene, what the WHO says is this: food hygiene is all conditions that and measures that are necessary during production, processing, storage, distribution, and preparation of food to ensure that it is safe, wholesome, and fit for human consumption. The main aim is to prevent food poisoning and other foodborne illnesses. Okay, so this is the main aim of food hygiene. So it implies hygiene in the production, handling, distribution, and serving of the food. So here you have different branches of food hygiene. Among the different branches we have milk hygiene, meat hygiene, fish hygiene, egg hygiene, hygiene of vegetables, food handlers hygiene, and sanitation of the eating place. So now why milk hygiene? Milk is an important source for most of us. We have milk in some form or other, either it's a cup of tea or directly milk or whatever. So milk gets contaminated by various sources like the udder. Udder is the place from where the milk is got. Utensils, personal hygiene of the handlers, storage environment, etc. So how do you purify milk? One of the methods of purification of milk is pasteurization, named after Louis Pasteur. So this is the process of preservation of milk, wherein the milk is heated to such a temperature so that it destroys all pathogens. So that's why we boil milk. Nobody takes milk directly from the cow or whatever. Okay. So this is also an example of, and remember it should be done without changing the color, smell, flavor, taste, and composition. And it's an example of a prophylactic disinfection procedure. So this is a method of preservation of milk, pasteurization. Okay. Now, there are a lot of diseases which are conveyed through milk. If the milk is not boiled, if the milk is not treated properly, what happens? You can get tuberculosis, you can get brucellosis, you can get Q fever, you can get septic sore throat, you can get food poisoning, you can get diarrhea, dysentery, cholera, enteric fever, hepatitis, and diphtheria. Okay, so the organisms are given there: Mycobacterium tuberculosis, Bacillus abortus for brucellosis, Coxiella burnetii for Q fever, septic sore throat, streptococcus, food poisoning, Staph aureus, diarrhea, Shigella, enteric histolytica, cholera, Vibrio cholerae, enteric fever, salmonella, and viral hepatitis, and also diphtheria. So all these come through milk. So it's important that milk is properly taken care of. Without milk hygiene, it's not possible to run the thing, have it properly. Okay. So now, why is it why is it important? Because it's milk is contaminated, can get contaminated to a lot of people. So you are taking one glass of milk from some same source, she's taking from another source, he's taking from another source. So from the same source. So you have two things. One is disease of animals which are transmitted to man, and disease of man transmitted to others. So among that, animals to man, you have salmonellosis, brucellosis, tuberculosis, Q fever, foot and mouth disease, anthrax. And disease of man transmitted to others include waterborne disease of viral hepatitis, dysentery, MBBS, giardiasis, staph, food poisoning. So these are all the things which are there in milk contamination. Okay. So that's why milk hygiene is very important. This we talked about. Now, what are the methods of pasteurization? This is a question which is often asked as a short note. What is pasteurizing? What are the methods? You have two methods. One is the Holder method, in which milk is heated to 65 degrees and then maintained for 30 minutes and then suddenly cool to below 5 degrees. So this is recommended for small and rural communities. But what we normally do is flash process, high temperature, short time. The milk is heated to 72 degrees, maintained for 15 seconds, and then rapidly cooled to less than 5 degrees. So this is recommended for urban areas for large quantity of milk. So you have the Holder method as well as the flash process. These are the two methods that are used. Okay, Holder method and flash method. So you may be asked, what is pasteurization? What are the methods of pasteurization? Then you have also ultra high temperature, where it is done in two stages. First, it is heated to 88 degrees, and then it is heated even to greater than 125 degrees, and then it is cooled rapidly and bottled quickly. So this is kept in cool temperatures till it reaches the consumers. So this is what happens normally in big places like Mother Dairy or some other Amul or something like that. Okay. So now how do you know that pasteurization has been done properly? You have a test for pasteurization. This is called the phosphatase test. This says basically that phosphatase is destroyed when the milk is heated. So if you have phosphatase in the milk after the process, that means pasteurization is not done properly. So this disodium phenyl phosphatase is added and incubated. If the enzyme is present, it acts and liberates the phenol. It's indicated by it turns blue. Okay, the reagent turns blue, the milk turns blue. So that's why phosphatase test is a test for testing whether the pasteurization is done correctly or not. Right? So quite often the pasteurization may not be proper. That's why the test is done. Okay. Then you have also test for adulteration. Now, what is adulteration? Adulteration means basically adding impurities to it. Now, it's been a long time. Whenever you go to an ordinary milkman, he always adds a bit of milk previously. Pani mein doodh mein pani. Okay, that's the usual thing. So, that is called adulteration. So, for that, you test the adulteration specific gravity between 1028 to 1032 if less water is present. Okay. Then this is recorded by using lactometer. Then again, fat content. Some milks have extra fat content. Low fat content means there's water has been added. Iodine test, few drops of iodine added to 5 ml milk. This also indicates the presence of adulteration if there's a blue color. So these are examples of adulteration, which means that the milk is not pure. Okay. So milk is not pure, some impurities have been added to it. Then you have a coliform count. Coliforms are a type of bacteria which should not be present. So when they should be absent or zero count in any 1 ml sample of milk. If it is present, it means the milk is not free from impurities. So now, what are the problems with microbiological hazards for any food? You have contamination, growth, and survival. The food is contaminated, then with some organisms, then the organism grows, and then it survives. So what are the common infections that we get? Bacterial infections, parasitic infections, and viral infections. Among the bacterial infections, we have E. coli, which is the most common, Clostridium jejuni, Shigella. Parasitic infections, we have Giardia, we have Enterococcus celtica, Toxoplasma, Sarcocystis, Fasciola hepatica, Taenia solium, and Taenia saginata. Taenia solium and Taenia saginata are hookworm infestations basically. Viral infections, polio, hepatitis A and E, normophilins, enterovirus, and rotavirus. So these are the common microbiological hazards of any food. So here you have certain criteria for milk hygiene. First is the animal should be healthy. A sick cow cannot give you proper milk. Secondly, the premises where the animal is housed should be sanitary. Third is the vessel should be sterile and kept covered, and water supply also should be bacteriologically safe. So unless you go to a proper dairy and all, you cannot see it. But then, if some of you can go to maybe close by, if you go to Bharat Sevashram, they have a very good dairy over there. You can see it if you like. They can show you. Okay. So So again, milk handlers, the person who is actually milking the cow, he or she should be freed from communicable disease, and also it should be cooled immediately to 10 degrees after it is drawn to retard bacterial growth. So below 10 degrees, the bacteria normally doesn't grow. Then again, there is another test, methylene blue test. It is carried out in the milk accepted with access. Definite quantity is added to 10 milliliters of milk, and sample is held at the uniform temperature 37 degrees till the blue color is dissipated. If this blue color is there, it means there is a presence of microorganisms in the milk. This is called the methylene blue test. Okay. So it is carried out on milk accepted for pasteurization, and definite quantity of methylene blue is added to 10 ml, and sample is held at uniform temperature of 37 degrees till the blue color is disappeared. Okay. So this is a test for indirect method for detection of microorganisms in milk. Then this we talked about already, Holder method, high temperature method. Milk is kept at 63 degrees for 30 minutes and then cooled to 5 degrees. High temperature, short time, milk is heated to 72 degrees, then it is dropped for not less than 15 seconds, then rapidly cooled to 4 degrees. Okay. Then what we normally do in the house is we get the milk, we still boil it. What we do is sterilization by heating the milk to 100 degrees and for 20 to 30 minutes. This destroys 100% of pathogens, but it diminishes the nutritional value. Okay. So then we talked already about test for milk, test for pasteurization, test for adulteration. So sterilization is what we normally do when we boil milk. We're supposed to boil to 100 degrees for 20 to 30 minutes. But that's not normally done. If you have a cup of tea, they're not using it, they're boiling for 20 to 30 minutes. But this is what is normally done, should be done. This we call coliform also we talked about. Then there are some other tests. Cane sugar again, it indicates addition of sugar in milk. Some people they add sugar in milk to make it more tasty. So you add hydrochloric acid and few grains of resources. Red color indicates that sugar has been added to milk. Okay, some people add sugar to milk to make it more tasty. Methylene blue test we added. We talked about 1 milliliter of methylene blue is added to 10 ml of milk and incubated for 5 hours. Discoloration shows this is the bacteria. And standard plate count, that is maximum permissible limit is 30,000 bacteria per ml of pasteurized milk. So after pasteurization, you can still get up to 30,000 bacteria per ml. But beyond that, it is not accepted. Okay. Next is meat hygiene. Now, after milk, we come to meat. Most of us take meat in some form. We have a few vegetarians. But among the meat, the people who eat meat, we have those who don't take cooked food, tapeworm infestations like Tinea saginata, trichinella, and fasciola hepatica. All these are tapeworm infections, which we will transmit by eating unwholesome meat. So before eating meat, the meat should be actually slaughtered. I mean, the animal should be slaughtered, killed. So for that, animals intended for slaughter are exposed to ante-mortem and post-mortem examinations. So meat inspection is very important before being accepted or rejected. So if you are any place where the meat is coming from, that has to be actually, they must have both this process. So if you're having, say, mutton biryani from somewhere, that mutton should be coming from some place which goes through this process. Okay. So again, antepartum means before death. So the animal should be inspected. The animal should be healthy. You cannot have a sick animal you kill a sick animal and then the sick thing comes to your food. So to screen all animals this time to slaughter, to ensure that animals are properly rested and proper clinical information. So suppose the animal is suffering from disease, that animal should not be killed. And to identify sick animals. The same thing for live animals and birds. That means chicken also come under this. Okay. So what are the causes for antemortem rejection? Like they say that don't touch this animal. The animal seems exhausted, emaciated because very thin. Pregnancy is another thing. There's also something called sheep pox, brucellosis, and diarrhea. So if these things are there, you should not kill the animal. The animal should be rejected for slaughter. Post-mortem, after you kill the animal, if you see that there's got some things like cystosarcosis boils, that is basically tapeworm infection, liver fluke, abscesses, sarcocystis species, hydrosis, septicemia, parasitic and nodular infections, liver and lungs, tuberculosis, cystosarcosis, cellular. All these can only be found after the animal is killed. Even after the animal is killed, you see body parts are okay, the intestine is okay, the lungs are okay. If they are not okay and they have symptoms of like tapeworm, liver fluke, or parasitic and nodular infection of liver and lung, TB, then that animal should not be killed. I mean, that animal is already killed. That animal should not be processed for food. Okay. So, good meat qualities. What are the good meat qualities? It should be neither pale nor pink or a deep purple tint. It should be firm and elastic to touch. It should not be too soft, not very hard. It should not be slimy, means it should not be slippery. The surface should not be slippery and should have an agreeable odor. Now, agreeable odor means it should not stink very badly. Okay, you don't need a mask to cover your nose to see it. So, this is the good meat qualities. And again, before this, there's another thing, the slaughterhouse hygiene. The place of slaughter, that should be neat and clean. Okay, it should be kept away from a place where residences are not there. They also have a public health act which standardizes the location, structure, disposal of waste, water supply, examination of animals, storage of meat, transportation of meat, and other activities associated with meat processing. So, basically, the place where the animal is slaughtered or killed, that also has got some specifications. There should be certain distance, there should be so much of water supply, it should be maintained clean. All this come under the Model Public Health Act of 1955. Okay. It should be preferably away from residential areas, and up to 3 feet should be impervious and clean, easy to clean. So it should not be the slaughterhouse should not be in a pool of blood or pool of water. It should be able to easily clean. Disposal of waste, this is very important. That should be done properly. If you don't just throw it on the road so that dogs keep coming and biting. It should not be discharged in the public sewers but should be collected separately. And water supply should be independent, adequate and continuous. It's not that the shop is open in the morning and the waste is there. The next water supply will come in the evening. It should be continuous. Okay, so that's very important in slaughterhouses. Then next is fish hygiene. Most of us are fish eaters. Of course, we take mutton also. Fish hygiene again, same thing, it deteriorates. Or loses its freshness because of autolysis which sets in after death and because of bacteria with which they become infected. Stale fish should be condemned. Now, signs of fresh fish. It is in a state of stiffness or rigor mortis. The gills are a bright red and the eyes are clear and prominent. Now, you will generally see if you travel in anywhere, in a flight or train, very rarely will you get fish being served. The reason is that it is difficult to maintain the quality of fish. You get chicken, you get egg, but very rarely will you get fish in a flight or plane. The reason is it's not easy to maintain fish hygiene. Okay, so that's why the government said we cannot ensure full safety. Not right now; it's been there for ages, many years, 40, maybe more than that. So you won't get in the train, you will never get in the pantry car, you will never get fish. You get chicken, you will get eggs, you will get vegetarian food, but you will never get this. In the flight also same thing. Very rarely you will get fish. Very, very rarely. Not in the Indian airlines, or you may get in some foreign airlines like Thai Airways or something like that. Okay, so the fish hygiene is most tricky because we cannot assure the quality of fish unlike mutton or chicken. Then the next one is tinned fish. Some of us take tinned fish. So a tinned fish again, the tin should be new and clean without leakage or rusting. There should be no evidence of having been tampered. It's like sealed openings. And on opening the tin, the content should not be blown out. indicates decomposition. So tin fish normally we have sardines, we have tuna and other things. So these are the criteria for tin fish hygiene. Now eggs is another thing we normally look at. Unfortunately, again, eggs is something we can't really assess eggs. But nevertheless, the egg shells become contaminated by fecal matter on the head. So when you go to buy eggs, you find sometimes one egg is purely white, everything is white. The other one has got some stains. That is actually fecal matter. So the egg seller will say, "Na kichu hobe na, thik ache." But that has contaminated by fecal matter on the head. And microorganisms, including pathogenic salmonella, can penetrate a cracked shell and enter the egg yolk, leading to spoilage. Okay. Then here also we can pasteurize the eggs to increase the shelf life. So eggs are also pretty important. The salmonella can penetrate a cracked egg. In fact, we don't know whenever it's a food poisoning, we don't know the cause. And then one of the causes which is generally mentioned is eggs can also be a cause. Then food and vegetable hygiene. Fruits and vegetables. Again, here there are bacteria, fungal, protozoa which can enter the plant material during the harvesting. And here again, proper washing and sanitation. So whenever the person who's selling it on the road, you should wash it. When you buy it, you should wash it in the kitchen. And they are washed to remove not only soil, they have also pesticide residues, insects, plant debris and microbes. So everything has to be washed. So even if you take a salad, nowadays most people want to take salads. Russian salad, this salad, that salad. That salad vegetable also should be washed. Not that you just take carrot and you have it. Carrot may be good, but what is the remaining things? Carrot, onion, cucumber, all this are there, but hasn't been cleaned. So that's very important that the proper washing and sanitization are needed. Okay. Even if it is a salad, even if it's not cooked, you're taking it as a salad, that is important. Now this is the most important thing. After all this, we talked about meat, we talked about milk, we talked about fish, we talked about eggs. This is something which is very important. This the handlers, the people who actually do the cooking, the people who handle the food, they are the persons who most likely transmit diseases. After all this, we take care of all this. What do the food handlers do? They look after diarrhea, dysentery. I mean, they can transmit diarrhea, dysentery, typhoid, viral hepatitis, enterovirus, protozoal cysts, and eggs of helminthiasis, streptococcus, staph infection, and salmonella. So how do you prevent this part? How do you prevent this part? You wash the meat, you wash the fish, you wash the eggs, you wash the vegetables. How do you prevent this? How can you ensure that this is not there? Any idea? So how can you ensure the safety of food handlers? Anybody? Huh? Food handlers, they are a big. How can you reduce this? Bola? Take a try, no problem. It may be wrong. Yes. Huh? The person who is giving you momos outside the gate. How can you test this? Whether he's got any of this? Or the person who's for whom you're getting Zomato, the packet from outside. How can you test it? I mean, you can't test the Zomato packet. I'm talking to the persons. What can be done? Well, take a guess. Take a guess. See, for your first stage, you may not be that. But take a guess. What can you do? Well, it may be wrong. Somebody please say, I want the answer to come from you. One answer at least. Huh? 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 What is? Sterile gloves. Very good. She said one good thing. Sterile gloves. So you need sterile gloves. Very good. So one of the things is that. So these are to safer food. Keep clean. Separate raw and cooked food. Cook food thoroughly. Keep food at safe temperatures. Use safe water and raw materials. Okay. Now we'll come back to the slide I showed you earlier. So keep clean. Wash your hands and surfaces that come into contact with food. Second is separate raw food and cooked food. Keep raw food, poultry and seafood separate from other foods. So what do you need for that? You're going to keep raw food, poultry food and this separate from other foods. What do you need? Yes. What do you need? You want to keep it separate. Common thing which we have in the households. You need a fridge, right? You need a fridge, you need an alvera or some sort of thing where you can keep it separate. Then cook food thoroughly. Cook it at 70 degrees to kill most microorganisms and keep food at safe temperatures. Okay. Food at safe temperature means it should be kept between 5 and 60 degrees, not below 5 degrees. If you're giving below 5 degrees, it should be kept in the fridge. Use safe water and raw materials. Okay, this is very important, using safe water. So unless the water is safe, the food will not be safe. Now this is important, what you said, just a follow-up of that. The food handlers, they should have periodic health checkups. Anybody suffering from these diseases, like medical examination should be carried out for all food handlers at the time of employment. Any person with a history of typhoid, diphtheria, chronic dysentery, TB or any other communicable disease should not be employed. And persons with wound, skin infection should not be permitted to handle food and utensils. Okay. So, and day-to-day health appraisal of these people should be also done. So, somebody coming with a running nose, he is going to cook your food. Then you will have some food poisoning, most likely to have food poisoning. Or if you, particularly if you see the puchka walas, not necessarily this puchka wala. Some puchka walas, they are making the puchka, but the same thing he's putting in his nose and maybe the puchka you eat is getting contaminated. Okay. So, day-to-day health appraisal of food handlers is equally important. Those who are ill should be excluded from food handling. Then, education of the food handlers. Now, the question is, why will the food handler do all this? He is not aware. He is worried about his salary and job. But you tell him, stay at home. You have to educate these people that if you come and if you work, your presence may lead to infections to the people in the canteen, to the people who serve. There has to be part of the person, they have to be educated for matters of personal hygiene, food handling, utensils, dishwashing, and rodent control. What is rodent? What is a rodent? What is a rodent? Rodent, give an example of a rodent. Rat. Okay, so most of the places you find where the kitchen is where you find rats, particularly where food is stored. Okay, so you have to make sure that there's no rat, that place is rat free. And personal hygiene to be promoted. What your friend was saying, the hands should be clean at all times, scrubbed and washed with soap immediately after visiting a lavatory or washroom. Then hair, to provide covering the head. We have these people, many places you find they are wearing a surgical mask over their head. And actually, after COVID, we became more cautious regarding spread of disease. Everybody was wearing a mask and a cap. But after COVID, thing has become normal. People are no longer using it. But this is, most places, they wear this cap. If you see films of any film, old films or current films, you see a 5-star hotel, you'll find a chef wearing a cap. He's using it not for style, just to prevent his hair from stepping into anything. Okay. So that is a general state. And even in many hotels, you find even the waiters, all of them are wearing these surgical caps. And clean white overalls to be worn by all food handlers. Coughing and sneezing in the vicinity of food, licking the fingers before picking up an article of food, smoking on food premises should be avoided. So these are the things which are part of the training or part of the education of the food handlers. Okay, these are the things which are important. So apart from the source of food, the treatment of the food handler is also a major component. In fact, they are the biggest component. Okay. So the problem is that you won't get people, most places you won't get people to do it. So if you go to check out in our canteens, nobody is following these rules of cap or anything else. Maybe they're washing their hands, that's about all. But otherwise, it's not there. So this is the same thing which we were talking all this while. Now, food, food habits and food hygiene. And here is one thing: production to consumption. So, suppose you something is consumed, and this also applies for. Sorry, this also applies for packed food. Okay, not just cooked food, packed food also. Food can become contaminated at any point during slaughtering or harvesting, processing, storage, distribution, transportation, and preparation. Lack of food hygiene can lead to foodborne diseases and even death of the consumer. So the problem comes when there is death of the consumer. So very often we find, lot of us have food poisoning. पेट खराब हो गया है कैसे पेट खराब हो होटल गेलाम पेट खराब हो गया बिये बाड़ीते गेलाम पेट खराब हो गया but पेट खराब is one thing, but once it becomes death, it becomes a bigger problem. Then comes how was it food poisoning, what is the food, etc., etc. All these things are taken into account. So normally in a small case, you had food from outside, you will have diarrhea and vomiting. You will say, I took this, I took Chinese food, that's why I had this. I took extra biryani from here, I had this. Beyond that, it doesn't go. But once somebody dies, it becomes a serious, very, very serious matter. Okay. But you have to prove that that person died because of the food. He may have died of a heart attack. But you have to prove that it is died because of food. Now, most of you people how many people like Chinese food? How many of you like Chinese food? Hattolo? How many of you like Chinese food? Chow mein, chili chicken, hattolo? Nobody? You do example. Nobody else. No, tell me, nobody else. Yes or no? I also like Chinese food. I'm raising my hand. Nobody likes Chinese food. Okay, you all like Indian food. Okay. So Chinese food has got some ingredient. In million Chinese restaurants, they call it monosodium glutamate, MSG. Okay. So some restaurants they say no MSG added, no added MSG. Some people they say added MSG. If you go to some restaurants in Calcutta somewhere, now MSG was something which is they say it's toxic and which causes what they used to call Chinese motion sickness. Okay. So which is why it is banned in USA, but it's available in the Chinese community. Okay. So officially you can't get it. So here you have the same thing. That's called Ajinomoto here. Ajinomoto is the common name. It's monosodium glutamate. That is one thing which makes it extra taste in Chinese food. People don't like Chinese food. That's good. But people like Chinese food. They go mainly for this extra flavor, which is there in this MSG or Ajinomoto. So this we talked about it, but I'm just going through this because it's got some specific diseases. Disease transmitted through meat. Cystic sarcosis cellular of Taenia solium through pork. Okay. So those who eat pork, they should be careful of this tapeworm infection. If the pork is not cooked properly, you can end up with cystic sarcosis cellular of Taenia solium. Cystic cellulosa of Taenia saginata through beef. So both beef and pork should be cooked properly, otherwise you can land up with tapeworm infections. Then liver flukes through sheep. They affect the liver, that is called fasciola hepatica. Trichinellus spiralis again through pork. Then you have bacterial infections like anthrax, actinomycosis and tuberculosis. And food poisoning through botulism. Botulism is something which is very fatal. That occurs through canned food. So suddenly the patient takes food and within a few hours, so less than 12 hours, he is dead. That is a sign of botulism. It happens through canned food. So these are the common diseases, the bacteriological names of the diseases which can cause problems. Taenia solium, that is pork tapeworm. Taenia saginata, that is cattle tapeworm. Liver flukes through sheep tapeworm. Trichinella spiralis through pork. Bacterial infections like anthrax, TB, and actinomycosis. And food poisoning, botulism through canned food. So again, fish also. Fish is an intermediate host of a tapeworm, and then also there is the Then some of the other pathogens are which affect fish are Vibrio parahemolyticus, Salmonella, and Clostridium botulinum. And fish poisoning is also there. Sometimes you take some unusual fish, you can land up with rashes or allergic reactions. Tinned fish and meat, bulging indicates decomposition. The fish is decomposed. The expiry date may be there, but if the tin is bulging, it means the fish has decomposed. On palpation, internal pressure is there due to gas formation and vacuum due to hole. On shaking, if there's shaking again, then if there's a sound is present, sloppy sound, like water is there, that means it's decomposed. Again, on the opening of the tin, there should be no smell. So these are important things for tin, meat and fish. Okay. Okay. Then again, inspection of fish. Once again, I'm going through it. Firm, stiff to touch. Tail should not drop when held flat. Eyes should not be sunken. Gill should not be muddy or pale. Scales should not be detachable. Consumption of stale food is condemned. So if you ever go to the fish market, you ask the person selling fish, fresh ache, or he'll tell you, ha, it's fresh, dekun, chon dekun, nahi dekun. He's an expert in telling you. Okay. So he looks at the gills. Gills should not be muddy and pale. Scales should not be detachable. So whether you're buying a Rui Mach or Ilish Mach, the same things. Consumption of stale fish is condemned and it should be firm and stiff to touch. Okay. Tail should not drop when it's flat. So if you keep a fish here, the tail should not drop like that. Then this we talked about ante-mortem and post-mortem examination of fish. We will not go into that. So these are again 5 keys by WHO. Keep clean, separate raw and cook thoroughly, keep food at safe temperatures, use safe water and raw materials. Okay. 5 keys to safe food. Now after all this, lot of talk about food and how do we actually, if there's some problem, who do we attack? Who do we tell? You ordered from some place, you had a massive bout of food poisoning, you admitted to hospital, 3 days you were in hospital on drip, and you say that this place is, I brought the food from there, that is why I got this problem. Who will you tell? So now we have an act in place, which is called the Prevention of Food Adulteration Act. This was the 1954 Act. This is an old act, okay. So they were looking only after fraudulent and deceptive trade practice, adulteration. Adulteration means adding things to food to make it look different, like adding water to milk for profit or adding something else to various things. That is adulteration. So that is 1954 Act, and then again it was amended in 64, 76 and 86 to make it more stringent. This was only dealing with adulteration, not with food poisoning or any other problems. But then subsequently, so this was this is the Food Adulteration Act. This is replaced now by FFSA, that is Food Safety and Standards Bill, piloted by Ministry of Food Processing in September 2006. This includes everything, okay, from production to consumption. So here under the definition of this, any substance, whether processed, partially processed, unprocessed, which is intended for human consumption and includes primary food, that is all raw produce except those in the hands of the grower, farmer, fisherman, genetically modified or engineered food or food containing such ingredients, containing such infant food, packaged drinking water, alcoholic drinks, chewing gum, any substance including water used in the food drinks, all this come under the definition of food. Okay. So here you have very big, very vast area in which food is included. So that, what is the objective of this FFSAI? The objective is to ensure the laws related to the food, to establish Food Safety and Standards Authority of India for laying down science-based standards for food, to regulate the manufacture, storage, distribution, sale and import of food products, and to ensure availability of and whole food for human consumption. Now, everything is important. Now, what happens is there are so many people, we are eating food from different places, from our own place, from the home and all. The problem is that this is a very vast act and it includes a lot of things. But there have been instances where this has come into play. For example, about maybe 7-8 years back, before Corona, suddenly they said that Maggie is not fit for human consumption. I don't know if you remember this when you were in school probably. So Maggie at that time, it was, all of you must be liking Maggie. Very easy to cook, very easy to eat, the rest of it. So they found some impurities in the Maggie. Then the Nestle company went to court and they did another test and whatnot. And then after 2 months, that ban was withdrawn. But that particular time, a lot of people were very worried. Why we have taken so much Maggie, 100 maybe kilos of Maggie. Will we all get poisoned by whatever extra thing was there? So that comes in the FSAI. Okay, so this is an important thing. So similarly, there was another one Cadbury's also had come like this. And again, they found some toxicants in the Cadbury. So that also went to where they was banned for some time. Then they took it to court, and then finally that also was restored. But the point I'm trying to tell you is that there is a mechanism. If you find that something is wrong with this, you can make a complaint through the proper authority. You have food safety officers in various districts and various municipalities. You can make a complaint. The only problem is that it's a very long process. Now, suppose you have had food today, you had food yesterday from some restaurant or somewhere, say from Domino's, you had a pizza. You land up today with food poisoning or vomiting diarrhea. Then what happens? You inform the concerned people. They say, okay, fine. They say, okay, do you have a sample of the Domino's which you had? How will you have a sample of the Domino's? If you already had it. They will go to the Domino's, pizza, whatever, and check for other samples. They will subject to that samples to testing. They may take 10 samples of whatever you had and then take it for testing there. And if they see that nothing is wrong, they say, okay, the case is closed. You may be still in the hospital, but they'll say the case is closed. On the other hand, if they find that there is something in the Domino's pizza which you had, they'll say, okay, there's a valid reason for creating a problem. They'll file a case against Domino's pizza that you added this structure or the pizza was not cooked properly or whatever else, and then the case will be filed. So this is the way thing. The only problem is that it takes a long process. For the consumer, when the person is affected, very rarely will you go through the process. But then definitely these people, they are there. They are supposed to check everything. Okay, and not only big restaurants but even small places. So you need a license for this. You need a license from FSAI, manufacturing, storing, including sorting and grading, packing, relabeling by third party under packing. So even actually, strictly speaking, even a packet of jhalmuri, that is also needs a license. Storage, warehouse, cold storage, retail trade, wholesale trade, distributor. Then again, these like also the milk chilling plant, slaughterhouse, solvent extraction unit, solvent extract and oil refining plant, importing food. Nowadays, the craze is for getting food from outside states, outside countries. Say ramen noodles, some things come from outside. Catering, dhaba. So even a dhaba is doing catering. You are having a party at some place and some person is a caterer. That guy also needs a FSA license. He may be cheap, but he also needs a license. In case something goes wrong, he will be held to task. He will be asked for explanation. তোমার ওখানে বিয়ে বাড়িতে 500 জনকে খাইয়েছো 50 জন পেট খারাপ হলো কেন? So that will be asked. Even club or canteen. So this whole thing of food safety and act contains a lot of things. All these people come under that, including the dhaba, including the canteens. Okay. So this is the framework. You have food safety officer right at the bottom. You have designated officer for licensing authority. Then you have licensing authority at district, state government. So if you look at the top, chief executive officer in the center. You have state government commission of food safety. Then you have registration authority, licensing authority. Under registration authority, you have a city municipal corporation, town panchayats, gram panchayats. Under the licensing authority, you have designated officer, license authority, and then the food safety officer. He is a person at the lowest. Now, the problem is again, very few staff are there. Like a place like Shantiniketan in Bolpur, you must be having something like 500 stalls selling, at least 200 to 500 stalls selling momo and biryani. You may be having only one officer over there, one person. So it's not possible for him to check everything. This is just for Momo and Biryani. I'm not talking about the other hundreds of restaurants, Gore Baire, etc., etc. So the staff is less. But if there's a complaint, they will definitely take care. So you have a central licensing authority also, FSCI headquarters, and you have zonal directors also. So this is the structure of the FSCI for the licensing and monitoring of food establishments. Okay. So this is something you will probably learn. This class, this FSCI bit will be taught in third year, but this is how the things work. I think this is my last slide. So that's my last slide. I hope you have got an idea of how what is the importance of food hygiene, what is the importance of milk hygiene, meat hygiene, vegetable hygiene, fish hygiene, and also food handlers hygiene, and also a bit of the Food Safety Act. I hope you got some idea, yes or no? Do it, sir.